Hey, it's Dr. Pierce from Michigan Sports and Spine, week 21. And they said it went last. We don't know if it's lasting, but we're still going. So Nicole says right away, do not get into any political debate stuff, and she's fringing right now as I start. I will say, I'm not going to get in political, but it was very enlightening for all age groups. For my family alone, and everyone where I was at was engaged in the debate. So it seems like it was a very popular event last night. Anyhow, not getting into it, but it sounded like two people who just wanted to argue for the sake of arguing, and I'm not sure if anything real very productive or meaningful came out of it. Hopefully our little Facebook Live episodes are more informative than the debate was. So jumping into it, this is October. We're jumping into October. So September's gone here. We're going into the last quarter of the year. This is where you start thinking about your New Year's resolutions from 2020 and saying, did I really get to it? For us, I push health, fitness, living well, living healthy, all that stuff. This is your chance to kind of make up for some of the stuff you might have missed throughout the year. If we can help with that, or if we can encourage you or inspire you, whatever it is, we would like to be able to do that. Just if you can do it on your own. We try to create this virtual team. This has been one of the weirdest years we've ever had on so many fronts. But it doesn't make excuses not to be successful at this point. Still, like I've told many people, you need to find the silver lining. What's going on? And I have one friend who's very optimistic and doesn't want to listen to the news, which I encourage. Not fill people's heads with negativity. Where's the positive in it? Everything's a positive. Even with individuals where the world has slowed down, for those to catch up. I mean, there's a lot of people, like one of my friends today, working from home, being more productive, getting closer to the kids, realizing, how much time missing with their children. It's a healthier environment. Not always working is the best environment. So I'm trying to be politically correct, but the overall thing is that there's a silver lining in everything. And I think for the last quarter of this year, that's where our focus really needs to be. And where we can be inspired, and is it working out? Is it eating healthier? Is it being nicer? Like the Jewish New Year just happened. It's a time where you kind of reflect, and this is the time to reflect and not be like, it's December, it's Christmas, I'm running like a crazy person again. We need to be productive with the time that we were given, and maybe that's what this whole COVID thing was about. Is taking a step back and finding out how I can be more productive and appreciate life a little bit more, which is really some of the biggest things I've heard from patients, is that this was a good little break. We're done with it, but it's a good little break, and coming out of it and resetting myself could be even better. So getting into the first question, so hopefully that gives you a little motivation of a start here. But the first question is actually a hard question. I may make it the second one, but we'll go for the first one. I've been diagnosed with adhesive arachnoiditis and find it impossible to find anyone that knows how to treat this 24/7 spinal pain or is familiar with my diagnosis. Can you please discuss? This is a very difficult diagnosis. It's a rare diagnosis, but it may be rare because we really don't look at it that way. First of all, arachnoiditis is a very big term. Adhesive is, again, basically what it is, it's frozen. Adhesive means like what you're hearing, you're adhesing to something. The arachnoid is part of the brain system. It's part of the spinal cord. It's part of the internal network of your spinal cord. And I'm assuming that's what you're referring to. And usually what happens is, unfortunately, sometimes you have an infection that gets into your body, but mostly it's from previous surgeries. Now, I don't know if this person's had a surgery before, and you create an adhesion. So it's layers. So when the layers are in your body's made up of multiple layers. In our skin, there's 7 layers going all the way down to the adipose, to the fat tissues, to the muscle. Below the muscles are the tendon. We peel back our skeleton. Our friend that that Nicole doesn't like to have behind me anymore, but I'm going to show them real quick. That's our skeleton friend that's still with us. But bottom line is, it's the layers, okay? So when you have adhesions, those layers are supposed to have free moving and fluids between them and healthy. So when your muscle moves or where your arm moves, you know, there's movements in so many parts of your anatomy, from your muscles, from your ligaments, from your bones, from your joints, everything, let alone the electricity that has to come out of your brain to make it work. But when those things are stuck together, you're right. Now all of a sudden, when you're shearing or you're trying to move through your anatomy or your spine, it's moving all as one piece, where normally it would shift across each other smoothly. It's moving as a solid piece. And that is uncomfortable, it is painful. Do we know how to treat it? It depends at what level. At some level, you need surgical intervention. At the minimal level, where it's like stretching a tendon. I don't want you to, it's similar to, but it's different. Like when you have a tight Achilles tendon, that muscle on the back that goes down to your heel, when it's real tight, in the mornings, for some of us older individuals, it's hard to walk on. So it's not like a true adhesions, but it's actually stuck, and you need to like mobilize it, or parts of your body. You know, like moving your shoulders, we roll your shoulders out. You have mild adhesions that form. They're not true adhesions where they're stuck, and if it is in your spine where it's stuck, there's a technique called raking, where we actually go through your spinal cord. We actually look with a little scope, and we create a raking. We kind of manually break it up. We can't break it up with, you know, some of the things we do with laser, deep tissue techniques. So it's a very, we're familiar with it, but at what grade you're at. If you're at a severe grade, then we're talking about surgery. If you're at a mild grade, then we will look at therapeutic measures to do that, through physical therapy, through modalities, through injections. Sometimes we'll put medication in there to force those areas to separate. So there are a few things to do. I will admit, we don't see a whole lot of it because it's not that common. So one, I need to know if you were properly diagnosed, and two, what was the reason for having it. Sometimes it happens from radiation. If you had any cancers, the radiation will, in the old days especially, will fry the tissues, and you'll get adhesions that way also. So long-winded, I kind of answered it, but I know I didn't answer it fully because it's a little bit more detailed. So again, you need to find someone like myself or someone in the field or in, you know, high-level pain management to treat you. You're not, you know, the run-of-the-mill type of patient. You are one of those more difficult, potentially what I call the university patients, where you need a whole team approach. So question 2 comes from a current patient. I could probably guess, but are CBD topical creams safe to use to relieve pain for bulging discs and lower back pain? So CBD, so basically CBD, you got to understand what CBD is versus THC. So CBD is the substance in marijuana that's more of the healing properties. They're finding more medical remedies for it versus the THC, which creates the high. This is taking the high away and taking the medical benefits from the marijuana and just labeling it into CBD. So CBD oils, creams, things like that. So the question really simply is, will it help with bulging disc and lower back pain? So the answer is hopefully yes. I've had plenty of patients try it, and it's to the point where I used to not even endorse it. Now I'm saying it can't hurt, why not try it? Probably the cutest story I had was one from one of my older patients. It was a patient of mine for years, telling me that where she buys it from, and she's been using it for a couple of years, and finally told me that kind of saves her on a nightly basis. And the funny thing is that where she bought it from Hallmark cards, which, you know, I know selling cards these days, greeting cards are hard, but that was just an eye-opener for me that it's really getting out to the public and the mainstream. And this is probably 2 to 3 years ago. So to answer your question, yes, it can help. Will it resolve? Will it shrink bulging discs? No. Will it relieve the tissues around? Yes. If you have a sore back, if you have inflammation, those things do help. Does it solve a bulging disc that's pushing on a nerve or a bulge like that? it helps as one of the tools. Is it a single tool? No. If it works for you, then great. If it's, I wouldn't spend a lot of money if it doesn't work after 2 to 3 times where you're feeling benefit. You may not invest more money in it. But a lot of people do find the relief. It works a little bit better on smaller joints like ankles and hands and elbows and shoulders. The back, if you're a thin person, then it only can seep in so far. So if you're a thin person, you got more of a chance to help with the spine and things like that. If you're a heavier or thicker person, it may not be as beneficial. It will help with the soft tissue around it, but may not be able to penetrate as deeply. So the answer is, I don't condone it. I don't endorse it. I think if it's one of those things where if it works for you, then great. Is it harmful? No, it's not harmful. Is it expensive? It's not too expensive, but it definitely can be one of the tools for you to treat. It doesn't replace stretching. It doesn't replace exercising. It doesn't replace all those things. But in a combination therapy, CBD oil or creams are, I can't say it's not any different than Icy Hot and some of the other things. Those have a capsaicin that has a different ingredient. The CBD has a different ingredient, so it's what you respond to. It's kind of like the anti-inflammatories. There's just different pathways on how you do it, and not every response is the same way. I find that my patients from the 70s respond a little bit differently, but that's a whole other podcast we can talk about. So question 3, why would I need both an MRI and an ultrasound imaging to find out if my rotator cuff is torn? What's the difference, and is one better if my insurance won't cover both? So basically, it's a great question. The biggest thing, MRI, as we talked about over the years, it gives us a much more detailed picture of the anatomy, of not just the anatomy, it's the ligaments, it's the muscle structure. So when we look at a shoulder and we're looking for rotator cuffs, that's all about the tissues, the muscles, and the ligaments. So we get a detailed picture. So number one, it's a very great diagnostic tool to see if there's pathology or a tear or an injury or tendonitis. What's great about ultrasound is that we can do something dynamically. So the biggest thing is what we call a dynamic ultrasound. And what does that mean? It means like when you have an obvious rotator cuff injury and you can come in, I can diagnose you from the door, versus those pitchers or those athletes that we get, or those individuals like I'm fine if I'm working, but if I go just like this where I'm pushing out a little bit and I'm putting a forceful, that MRI is not going to always pick up that dynamic motion, because what's happening is what we can see in the ultrasound is those ligaments that roll over in between the ball and socket joint. If it moves and it's now slightly being impinged, then that's what we can see on an ultrasound. So we can see different anatomy because we're actively moving. When we're actively moving is a lot of times when the pain is being produced. Like a complete rotator cuff, yeah, that's an easy one. But what we call the labrum, which are the 2 big ligaments, so there's the ball and socket with the 4 big muscles around it for the rotator cuff muscle, but there's 2 ligaments internally that hold it in. That's called the labrum. And you'll hear a lot about a labral tear and things like that. Those are the things that we more actively need to see, because when we're in an activity, the pain gets worse, or my golf swing, or when the easy one's the pitcher or the football quarterback. When they get to that level, I just don't have the strength, or I have to give out, or it's called an impingement. So to answer your question, if you have to pick one, the MRI is going to be much more detailed if that's what you're having. If you're having a problem where it's just in a certain motion or a certain position, a dynamic ultrasound is good. The problem with dynamic ultrasound is that it gets down to the user. The user, meaning the person who's doing the test, has to be very well trained in looking at musculoskeletal structures. So there's only not everybody's created equal. The MRI is a little bit closer that a lot of people can read it correctly. The ultrasound, you have to go to people that are familiar with it. Like we do dynamic ultrasound, meaning we know what we're looking for. We look at the position that we want to see you in, and we look for that impingement or that tendonitis or that fluid-filled area or that partial tear that we're worried about. So that's what we're concerned about. So we have a few friends watching from St. Mary's Surgical Center. So thanks for watching, and hopefully all nice comments. Yeah, I think you had an impingement too. So hopefully, the bottom line is MRI for an overall is better. If you have a certain area that's just with certain movements you're hurting, the dynamic ultrasound, but you have to go to a sports medicine doctor, or at least a sports medicine team that understands more musculoskeletal. So that would hopefully answer that question, which I'm supposed to stop saying. So question 4. My son plays basketball and lacrosse. What are the most common injuries you see with these young athletes? So when we say young, I'm going to assume they're 14, give or take a year or two. The biggest injuries are overuse, overworked, overdone. Because what's going on in adolescence, which is across the board with all sports, is that, like my son right now, he's 13, going to be 14 here in a couple months. He's having a growth spurt like crazy. So what happens, and I watched him actually playing lacrosse last night, what happens is the bones, as they grow, and this is such an easy concept when we say it, and people are like, oh yeah, that makes sense. When you're growing, the bones are growing. So the muscles and the ligaments are at their weakest point, okay? So when you're playing an elite sport, which all these kids are doing right now, no matter what it is, if it's basketball or lacrosse or football, cross country, anything, you're creating a situation when you have a growth spurt, especially if you have a great growth spurt where they're growing like an inch a month, your ligaments don't catch up, your muscles don't catch up. So you're actually putting your body at some of the weakest times. So when I've talked about core strengthening, not just core strengthening of your back, it's the core strengthening of your ligaments. So your shoulders, your hips, your knees, like we talk about runner's knee, we talk about growing pains. All those things are true. They're generic names, but they're all true. And what it all mostly boils down to is that the muscles and the ligaments lag behind. What period of time they lag behind? It depends. So if you have an injury during those growth areas, you're talking about growth plates on the bone, those areas become very vulnerable, very at risk for injury. So it's not always good to be pounding on that young body. You know, I talk about gymnasts. Gymnasts they develop in that. Female gymnasts are tough because they're pounding on that body, and there's, they say, oh, it's stunted their growth and things like that, and people say it's not true. It is true. There is some truth to it because you're pounding on growth plates. So you in some ways you have to let the body naturally develop, and you got to be conscious of that overuse, that overwork, that overtraining. My kid is the next best pitcher. He needs to have batting coaches, pitching coaches, strengthening coaches, but somebody needs to be on the same page and say, look, we're overdoing it, we're over-repping them. So those are like the overall. Some of the common injuries in basketball, there's a lot of knee injuries in basketball, some back injuries, but a lot of knee injuries, a lot of ankle injuries, coming down wrong, it's balance. The biggest thing I find out with young athletes is their balance is poor. Like I make the challenge, and if you've listened to me before, it's just, how's your balance going up on your toes? Can you go up on your toes 10 times on one foot? Can you do a dip? Can you do the ladder drill without hearing your feet smacking the ground? All those things make a difference. So the whole preventative, which is really what I push, is that you need to be aware of that growth factor for your adolescent kids. You don't want to over push during those periods of time. You still need to train, I understand. Maybe train at a 70, 80% instead of 110. You just need to have body awareness. A good trainer is going to be able to help you with that. But again, knee injuries, ankle injuries are probably the biggest for basketball. Lacrosse, to be honest, it's a collision sport these days, depending what age you're at. So again, there's ankle, knee injuries, usually back injuries, neck injuries shouldn't be unless you're in an odd position. Shoulder injuries a little bit more, but usually not. Usually you're looking at knees, ankles, sometimes hips, but if there's hip involvement, then something's wrong with your mechanics. If there's spine issues, if you got hit indirectly, if you get undercut like I did in basketball when I was 15, that put me out, those were just weird episodes. Those aren't the common things for basketball injuries. So overall, it's muscle, the muscle development you have to be careful of. You need to be careful of knees and ankles. The other big thing with knees and ankles, why you have it, is because they're very weak. The outside of their foot is very weak, changes their dynamic. And if they're during a growth spurt, you're looking at extra tension on your anterior cruciate ligaments and things like that. So the meniscus and stuff, excuse me. So question 5 comes from our stud medical student that's working with me that I feel like he's getting cheated because we're doing mostly telemedicine. But, he's a budding PM&R doctor, sports medicine doctor. He played college baseball. And he actually said to me, which brought up some of the stuff that I was talking about a minute ago, that his sport was baseball. And he felt that he wasn't treated properly because his fastball never improved from the middle of his high school till he graduated college. So what happened is mechanically he was deprived or depleted or whatever the word is. I don't want to say mistreated, but wasn't handled correct as well as he could have. Because as you grow, you should be increasing your speed, your mechanics, your strength, all that as you go through high school. Every year you should improve until you max out, where he never got to max out. He had to be forced to start what he called throwing junk. So when you start throwing junk, it puts more stress on your shoulders and your elbows. But his question is, what's the difference? What makes a well-rounded pain fellow, anesthesia or PM&R? So I'm not here, I'm obviously biased to physical medicine rehabilitation because that's what I am, but it also gives me a different basis of what we do. We really take a step back. Anesthesia, I'm not here to, these guys are good, they know how to stick a needle in things and handle it. Do they work as well-rounded as a PM&R doctor or like myself? I'm an osteopath where I have more hands-on skills. We train with our hands a lot more. I'm able to recognize what's going on a lot more readily. And it's not just because of my 20 years, it's the background, it's the training. So overall, I definitely feel like PM&R has a much different approach that's more holistic. We take in the whole picture. Like I said, it's not just the back pain. It's not just the back pain I'm concerned about. It's what else is going on. Is it the hip pain? Is it the knee pain? So many times I have patients, I can't tell if it's my hip, my knee, or my back. And usually we need to come down to what we call the primary pain generator. PM&R is going to do that. We're not going to chase a knee pain that's being caused by something else or a hip pain that's considered referred. We want to make sure the proper diagnosis. And not every PM&R doctor is created the same. So in some of the anesthesia and some of the guys I've talked to, they want to learn that examination skill that they they miss because, like for me being in sports medicine, I do a lot more with my hands. I do a lot more with muscle energy, muscle balances, atrophy, what we call segmental motions. We just take it to another level. It's not just like, okay, you have back pain. Your MRI says you have a pinched nerve at L5, therefore we're going to go at that nerve. A lot of times, yes, we do that, but there's more entailed. So that whole approach of what we call holistic approach is becoming something that people think has been said most recently, the holistic approach. Well, I've been saying that for over 20 years. The osteopathic community says it since the day they started. It's just a different way of looking at it. It's not a single, okay, my finger hurts, that's it, I get that one. But it's everything else that's involved. You can't just isolate out a hand injury. You can do that. So I had someone I had to meet today, his son has a hamstring injury, and he's like, I'm not sure if the trainer knows what to do. The thing is, when that hamstring injury doesn't get treated, it changes the mechanics. The easiest way to talk about is when I get hamstring injuries with my hockey players, you start seeing them short striding. They're still skating and they're still moving the puck and everything, but you start noticing on that, if it's the right side, their stride is different on the right side. What happens? What happens is they start hurting their knee, their hips, and their back because they're changing the mechanics. All of a sudden, the pelvis starts shifting. So everything works on our body. It works as a mechanism. The whole thing has to work in sync. So you need someone who can take a step back and notice what's in alignment and what's out of alignment. And you need to correct it. It's not just here's a pill for this or here's an injection for that. You need to move on and make sure you see someone who's who's going to take an approach that's looking at the whole body. So overall, I would say PM&R would be a more well-rounded physician. No insult to my anesthesia friends. So in summary, basically we're looking at alternative treatments. We definitely look at alternative treatments. We want to look at you as a whole. Proper diagnosis, again, is crucial. Not every physician's created equal. Make sure you go to the physician that has the right tools to make the proper diagnosis for you, which is key. Just like, getting work done at your home or anything like that. You're not going to hire the plumber to do the electrical stuff. You need the right person to do the right job. And like right now, we had a case today where we have something going on in the brain. That's not our specialty, but we're going to get you to someone who has that specialty that we have confidence in. And basically, feel free to reach out. I mean, we're looking at it, like I've always said, Dr. Bonet's here, we're here. It's freeing my time up. Also, we're more available. We're looking to treat you or your family or your friends. Share these videos. Hopefully, give us feedback. If you think we're doing the right thing, then give us that feedback. I'm encouraged by the questions. I'm encouraged by the people, but we want to reach more. We want to be able to do have more of an impact. So I went over my time today. I was supposed to be shorter today. I think it was that whole debate thing. I just felt like I had to get one more word in. So peace out, and love you all, and hopefully you learned something today.